Hi, this is Jeff Levinson with Ingber&Weinberg with today's 3-minute video blog. This morning, the California Assembly passed Assembly Bill 664, which will now go on to the Senate for review and ultimately the governor for his signature. This bill will create a new labor code section 3212.18. This will be effective January 1st of this year, retroactively. This new section will create a conclusive presumption of injury due to a communicable disease. Communicable disease is a disease that can be passed from person to person either through the blood, bodily fluids, or airborne particles. Examples are hepatitis, AIDS, the common flu, West Nile virus, measles, and even sexually transmitted diseases. Injury will also include situations where an employee does not come down with the disease or even diagnosed with disease, but where they're directed by a healthcare professional or their employer to self-quarantine away from the workplace. Now, we had an example here last month with one of our employees whose wife works in a hospital and was exposed to the coronavirus. She was directed by her employer to self-quarantine for 2 weeks. She would qualify for injury and benefits in that situation under this new statute. The statute will apply to active duty safety officers, active duty firefighters, and certain healthcare employees who provide direct patient care. Now, there's no definition of direct patient care, but strict interpretation would be nurses, doctors, physical, respiratory, occupational, and even speech therapists. Again, this could be expanded. In addition, the employee must work at an acute care hospital, which is your typical 24/7 inpatient hospital providing surgical, laboratory, therapy, and nursing services. Also, it would include a 24/7 inpatient rehabilitation center providing occupational, speech, physical therapy services, and an inpatient psychiatric hospital. Now, the benefits are typical: temporary disability, permanent disability, and medical, but also will include reimbursement for protective devices, masks, respiratory units. Also, the employee would be entitled to reimbursement for extra expenses due to quarantine and temporary housing expenses if directed for quarantine by, again, the employer or a healthcare professional. Now, we'll continue to monitor the bill, and certain provisions could be modified by the Senate prior to review by the governor. There are also other bills we will continue to monitor. So, stay healthy, stay safe.